Welcome back to Street Beat. Wayne State is hosting a ladies' night out health crawl this month to help inform women about important health issues. My next guest is Dr. Tochi Okwuosa from Wayne State University Physician Group. Thank you so much for joining me.
It's my pleasure, Rob.
Did I get the name right?
You did,
Okay.
pretty well.
Very good. So can you tell us about the health crawl?
So the health crawl is going to be hosted by Wayne State University Physician Group, and this is May, and the week that the health crawl is going to be held, it coincides with the Women's Health Week, and what we're trying to do is get a bunch of women together along with a bunch of physicians to kind of explain to these women about their health, things to look out for, and how to manage their health better in future. We're going to have physicians from different specialties. I'm a cardiologist, and so I'm going to be there talking about heart health. And we'll also have dermatologists that will talk about skin care and skin cancer. We'll have primary care doctors and gynecologists that will talk about things like menopause and gynecologic care. We'll have people talking about arthritis, and we'll have a plastic surgeon actually talking about cosmetic surgery and things like that in women.
Okay,
so we'll have a lot of physicians there.
A pretty broad spectrum of issues to cover as well.
A pretty broad spectrum of issues. And the event itself is going to be held on May 14th in Troy.
But can you tell us how Wayne State University got involved?
Wayne State University, this came off Wayne State's volition to want to help women within the community. As you know, Wayne State University is located within the Detroit area, and our patient population, a population that actually need to know more about their health and get more involved with their health. We know that heart disease is the #1 killer in the United States, and it's particularly a major issue within Michigan, which has one of the highest rates of heart disease in the country, and Detroit particularly has even one of the highest rates of heart disease, obesity, and poor health compared to the general population of the country. And so given Wayne State's location, it was very important that we try to do something to kind of try to get a community of both men and women, but women particularly for this month, involved in their health and ways to make things better.
And can you explain a little bit why it's women only for this?
Because this is May.
This is May is that month.
Right, exactly.
Now, what is your segment? You're going to be. You said are you speaking at all at this event, or I mean?
I will be speaking at this event, and my specialty is heart disease. I'm a cardiologist, and so I'll be talking about heart disease in women and what women should look out for, the different kinds of risk factors to look out for.
Can you explain? Can you tell us some of those risk factors to look for?
Oh yes, for sure. The main things to look out for are hypertension, and I think people should know what their blood pressures are, and if the doctors prescribe medications for high blood pressure for them, they should make sure they take them. The other things to look out for would be diabetes. People should know what their blood sugar levels are and how to take care of their blood sugar so that things don't get worse and it doesn't affect other organs within their body. Their cholesterol. Everybody should know what their cholesterol numbers are, and if your doctors prescribe medications to bring down your cholesterol, you should make sure you take it. People should make an effort to lose weight and to diet and exercise as much as possible to improve their health. And it won't just be your heart health, it will also just be your overall health and overall well-being as well.
Right. Can you explain some of the misconceptions about heart disease?
One major misconception that I can say is that most people think that heart disease affects men more than it does women. When we talk about heart disease, people tend not to think about women. But that misconception comes from the fact that most of the heart disease trials from the 1970s and 1980s were mostly performed in men, and it was only recently in the 1990s and in the 2000s that we started to involve women in most of these trials, and we're finding out that heart disease is actually the #1 killer in women.
Oh,
and
wow.
Women need to be aware of that.
So that is a major misconception.
It is a major misconception,
wow.
Exactly. And I think another misconception is just up until a few months ago, most physicians used to think that women had these, what we call atypical heart disease symptoms. You know, women don't have typical chest pain like men do and things like that. But we're finding out more and more that women have symptoms that are typical, the same as men do. But there are also other symptoms to look out for. So apart from chest pain, things like shortness of breath, things like just feeling tired and not knowing what's wrong, or things like just feeling like you're nauseated or wanting to throw up, or back pain. So there are other symptoms that we think about that are associated with heart disease, apart from the typical chest pain that people are aware of.
Now, if there was maybe one of the most important preventions, could you maybe list a couple things that are most important as far as preventing heart disease?
Preventing heart disease would be making sure if you're up to the age, so I would say men above age 45 should really take aspirin. And for women, we usually say women above age 55, although we're finding out that the women should take aspirin mostly if they're at risk for stroke also. Then they should be taking an aspirin. Another thing which I mentioned earlier is also diet and watching your watching your diet and exercising.
Yeah.
Those are very, very important points to help improve heart health.
Okay.
Or prevent heart health.
Very good. So we will look forward to that. And thank you for coming by the show today. And for more information, you can visit wsupgdocs.org. Coming up next, one local group is challenging you to get up and get fit. Find out more when Street Beat continues.